NCH here in Naples is partnering with the Hospital for Special Surgery to open a world-class orthopedic hospital here in Naples this year. Dr. Patrick A. Smith is a nationally recognized expert in minimally invasive sports medicine, and he has been appointed head of sports medicine at the new NCH HSS Hospital for Special Surgery. As everyone in the New York area and really across the country knows, when you need work on your joints and on your bones, you go to HSS. Dr. Smith is going to share insights on this new facility and what is in store, as well as on breakthroughs in minimally invasive surgery and orthobiologic therapies to treat conditions like early osteoarthritis. Please welcome Dr. Patrick Smith. Hi, Pat. Welcome.
Hey,
it's all yours. The clicker is...
Yep, got it.
I think the clicker you got.
Thank you. Good morning. Certainly, it's my pleasure to be here. I want to talk to you today. We're going to change tune a little bit and talk about some new developments in surgery. I'm the guy that likes to use those medieval instruments that you're seeing in the back over there. So that's my game. So we're going to talk about what we term nanoarthroscopy. And also, I'll spend a little time at the end and talk about the field of orthobiologics with stem cells and PRP, which is always very popular. Again, I'm happy to be part of the new hospital, which will be opening May 1st here on Immokalee down the street for the combined collaboration between the Hospital for Special Surgery out of New York and Naples Comprehensive Health here in Naples. So just by way of background, years ago, a long time ago, I was an athlete. So long ago you can't even get a color picture. This is for my career as a basketball player in 1970 before I was injured. You can see I have the short shorts, which nobody wears anymore, and the Converse Seekers, which had no support, so a lot of sprained ankles. But in any event, I injured my knee at that time and ended up having a major surgery that took my athletic career out, but really spurred me to a career in orthopedic surgery, and particularly to help athletes. So I was at the University of Missouri for 38 years and took care of the athletes there as head team physician, which was a great part of my career, and then I was recruited to come here to Naples to run the sports program at the new hospital. So my goal always was to deliver care for the athletes that I took care of that was better than the archaic methods that we used back in the 70s when I had my knee surgery. So we're going to talk about surgery. We're going to talk particularly about arthroscopy. So I want to educate you about this field. This is a picture from a magazine many years ago of what was termed the new arthroscope, which was a way to look into the joint. So we visualize the joint through small incisions. So basically what we do is we distend a joint with fluid. We have a camera with a light source that allows us to look into the joint. And we work in the knee, the shoulder, elbow, wrist, hip, ankle, foot. It goes back a long way. It was first described in Japan in 1918. It was brought actually to North America by Dr. Robert Jackson out of Toronto, who was a good friend with Reinhold Schmieding, who's the founder of Arthrex, and actually helped Reinhold in the early days get his company going with the new arthroscopic instruments that Reinhold was developing. So we go from what you see on the left, which is what I had done, a big giant incision that some in the room as old as me may also have these big incisions, to where we started using our scope to make smaller incisions seen in the middle for doing what we call ACL reconstruction, which is a major ligament that we work on for sports injuries. And now on the right you can see a technique that I was involved with developing here with what we call an all-inside technique with minimal incisions. So the scope is less invasive, but things have gotten a lot better because, as we know in our world, technology changes everything, what you're seeing here today. And it's happened in the field of arthroscopic surgery for us. And that technology is the nanoscope, or the nanoneedle, that was developed here at Arthrex. And I just want to show you the conventional arthroscope you see here has a 6mm sheath, and the camera is 4mm that fits in the sheath. We have these little ports that allow us to put the fluid in, and again, the light is attached to the camera. Well, now the nanoneedle is basically half the size. So the sheath goes from 6mm to 2.4mm, and the size of the actual scope is now 1.9mm compared to 4. It's half the size. So to show you what a difference this is this pictorial here. You got a picture of a dime. The general surgeons use what's called a laparoscope, and that's 10mm in diameter. Our traditional scope was 4mm, but now look what we have, a 1.9mm basically needle scope. So the camera is a chip on a stick with a light source, and we can look into your joint now through this very small incision. So it's incisionless basically because it's a needle. And so we can do this procedure under local anesthesia now. So it's much safer. We do not have to put you to sleep to look into your joint. So that has some major advantages. No scars, less pain. We do not use narcotics postoperatively because it's so minimally invasive, and we see an inherently faster recovery with our patients with the nanoscope. So I was a part of the work that was done here at Arthrex developing the product, and I was able to do actually the first human case in July of 2019 when I was back in Columbia, Missouri. Ryan Keller here was the product manager, and so he came to Columbia, and we had 4 cases scheduled that day to do the first nanoarthroscopy. So there's a picture from the operating room that day with me working. But we had a problem, and as scientists know, you make advancements through adversity, and we had a big problem with visualization. And what we didn't realize when we tested everything here at Arthrex, we would work on cadavers, and cadavers, of course, have no blood. And so we could see everything just fine. Well, what happened in the human situation is all of a sudden we had encountered some minor bleeding, and we did not have enough flow, so I couldn't see. So it was really kind of a tough day for us here because we realized right away that we had a problem with fluid management. So that was a tough phone call for me that night. I had to call Reinhold and say, Reinhold, we had a problem. We didn't have enough flow. We couldn't do the procedure with the nanoscope because we just didn't have enough flow to see. But Arthrex Innovation, only in 5 months, came up with a new high flow sheath. And so what this did, the adversity of that first day led to further development. And so then the Arthrex developed this high flow sheath where now we could get enough fluid through the nanoscope that we could actually see and do the work we needed to do. So this was revolutionary, and this really is what has jettisoned us into the future. So in addition to the scope though, now we had to have small instruments because when I do work in the knee or shoulder, I have to have the instruments to do the procedure. So Arthrex has developed this whole litany of instrumentation, the medieval instruments you see in the back table there, that we use to do our work. So again, the idea of the smallness also came in the smallness for the instruments that we use, as shown here. So here's a picture of a knee joint done with the nano, and it's high definition. It's great. Look at the visualization. That's a femur, and there's a meniscus right there. You can see very beautifully coming in here. So we can do the work that we need to do just as well with the traditional arthroscope with the small needle-sized scope. You know, we've gone from X-ray, which everybody knows about, was kind of our first way to visualize joints. Then MRI came along, and now we're to the point where the nano, I think that we will see a point in time where you may come in with an injury, and instead of getting an MRI, we will put the nanoscope into the knee joint as an outpatient, as in the clinic basically, just as a diagnostic procedure. It's going to be that advanced. So I think the nano really is going to change the field of arthroscopic surgery and diagnosis as well as treatment. So where can we do the nano? We've talked about the knee joint, but we also do it in the shoulder, elbow. Because it's small, now we can do things in the hand and wrist that never could be done before. It can be used in the hip and then the foot and ankle. So it's all over joints that we can use this particular procedure. So about the knee, this is again a case looking at a knee. This is just how it's done, where we have our small and tiny little placement of the scope on the right and our instruments on the left. We can do what we call meniscus work, which is a common arthroscopic procedure. Many of you may have had that done. We can do what we call debridement or chondroplasty. We can take out loose pieces. And now we can even repair the ACL, which never could be done before, through this tiny little scope. Many times in the knee, it's very difficult to do some more complex procedures, and sometimes we'll actually put 2 scopes in because we can see in hard places to visualize by placing 2 of the scopes in place. Shoulder, very important in the shoulder also for what we call instability, where athletes will have dislocations of their shoulder and tear what's called the labrum or the cartilage. We can fix that with the nano. We can work on the biceps tendon. We can do some rotator cuff work. And again, it's secondarily a camera that's nice because in the shoulder, we do a lot of work in the joint, and we also do work on top of the shoulder, basically what we call the bursal space. So we have to look in 2 different places. So we can actually put a nanoscope in the joint and work up on top on the rotator cuff and see both. So really advantageous to help us do better surgery with the nanotechnology. Foot and ankle, very revolutionary work has been done here for impingement, where you can take off bone spurs, as you've seen here with a little bit small shaver, cleaning up inflammation in the ankle joint. And again, small joint, but we can see very well with use of the nanoscope. It's also helpful in the ankle for fractures, and it can be used in the foot for release of plantar fascia for people who have chronic plantar fasciitis type pain. And the wrist, another advantage. Very small joint, as you can see here, but a very small needle, 1.9 millimeters. We can do work on what's called the triangle fiber cartilage, which is a cartilage that gets torn in the wrist. It can be used for ligament repair. It can be used to be treated for CMC arthritis or base of the thumb, where a lot of people have arthritic type pain. And also it's helpful for fractures, a lot of distal radius fractures. And to assure that the alignment is accurate, you can use the nanoscope at the time of fracture fixation. So a huge advancement there. This is a technique that Arthrex has developed for release of the carpal tunnel under local anesthesia. Carpal tunnel is a very common problem with pressure over the median nerve. And this particular device is totally safe, allows to release the nerve watching with the nano. And you'll see in this video, this patient that had this procedure done is totally awake. And you'll see her just here in a second. The total procedure time, there she is, wide awake. And the procedure time was 1 minute, basically, is all it took. And so she's wide awake and walks out, done, finished. So again, this is technology that's changing our world in surgery, making patients' experiences that much better. So you're awake and it's an outpatient. So again, big advantages, no anesthesia, and the need for pain medication. The risk of opioid dependence goes way down by doing this new technology for surgery. We're fortunate that at the new hospital, which again opens May 1st down the street, HSS and NCH, Arthrex has supported 4 nano suites, as seen here. Beautiful murals on the wall, so while you're having your surgery, you can watch the fish on the wall, or we can put a virtual reality headset on, or you can listen to music and I'll fix your knee or your shoulder in this relatively painless way at an outpatient, and you're totally awake. So proven benefits: faster recovery, quicker return to work with the nanoarthroscopy. Less pain, fewer surgical complications, low risk of infection, very important. Again, we've talked about the need for no narcotics postoperatively. And really, the better visualization may lessen future needs of MRI and such, because we see everything so well with the nanoscope. Over 50,000 have been done. You know, that first case in July of 2019, we've come a long way. 50,000 procedures as performed as of this February. 94% of patients would do the procedure again on surveys. 2 weeks they realize they have better quality of life than what they would have expected with traditional surgery compared to those patients. And in the ankle, 96% of patients return to normal activities within 4 weeks. So again, this has really revolutionized surgery for us and for you, the patient, to get you back on your feet, back to your activities much quicker with this minimally invasive procedure. But it's expanded now from orthopedics. Now cardiothoracic surgeons are actually using the nanoscope, using it for pleural biopsies, using it for valve procedures now. So it's gone from orthopedics now to cardiac. Spine surgery, another big development. You don't want big incisions in your back, and spine surgeons are now using this nanotechnology for nerve work. They can use it for replacement of what are called pedicle screws for surgery and help with fusion. So again, the expansion of nano has gone amazingly. So let's just switch a bit to orthobiologics. I want to talk a bit about this, and we need to start with some basic science about what is in blood. And in blood, you have your red blood cells and you have your platelets. So we're going to really focus on the platelets. That's the key when we talk about the benefit of orthobiologics. You also have what are termed white blood cells, multiple types: basophil, neutrophil, eosinophil, monocyte, and lymphocytes. We don't really want the white blood cells, particularly in treatment of knee arthritis that I'll talk about. So this is a nice animation of what a platelet looks like in your blood, swimming around, has these little tentacles basically. And the platelets are key because they have over 1,500 proteins and they have over 300 what are called growth factors. And the growth factors are what really make orthobiologics happen. The growth factors that are released from the platelets, they have anti-inflammatory effects, they're analgesic, they modulate healing, antimicrobial, and they're anti-degradative. So there's all these great quality of the growth factors. That's what we want to distribute if we give you an injection, say, of something like platelet-rich plasma or PRP, or if we talk about stem cells in a minute. So I think the best way to think about PRP or platelet-rich plasma, it's basically a nutrient for joint health. It's like the fertilizer to help things grow. So for me, I was lucky enough to be affiliated with Arthrex, and they developed a product called a collagen conditioned plasma, or ACP. And I studied this back in 2016 and was interested in the effect of this for treatment of knee arthritis. Now, at that time, the FDA had a study done that sanctioned that it was safe for patients to have this done. So this was the first FDA study approved to look at safety. They were interested to make sure that if platelet-rich plasma was administered to patients with knee arthritis, that it did not cause any side effects. Well, we were interested, did it help the patient? So both were accomplished with this study. And what I looked at is I had 30 patients who had the platelet-rich plasma, and those that did not had just a saline injection. And what we found for the FDA, we had no side effects. We had no problems with administering the platelet-rich plasma to our patients. And every patient, everyone that had the ACP treatment that had knee arthritis had significant pain relief at 1 year. So it was both safe to do and it was efficacious. And you can see here what it looks like. The platelets is the yellow layer. And the advantage of this particular technique is it's a centrifugation, takes 5 minutes. We draw your blood, 15 cc's, spin it down in a centrifuge, extract that yellow platelet layer, and that's what we inject. We don't inject the red blood cells or the white blood cells. So it's the platelets and those growth factors that have the positive effect for treatment of knee OA. So again, a nice way to treat patients with arthritis without necessarily a surgical approach. So where else do we use it besides knee arthritis? I use the PRP for common tennis elbow, very common problem, particularly here in Florida. CMC arthritis is a very common problem that females tend to get. The base of the thumb joint gets arthritic and painful. This is a great way to treat that without surgery. You can use it for plantar fasciitis. I've done that. Rotator cuff problems, bursitis, inflammation. PRP can help that better than steroid. It's more lasting than steroid. And I've used it for Achilles tendon problems. So this type of injection is biologic. It's your blood, it's your platelets, it's not anybody else's. And again, it has these positive effects for healing due to the growth factors and lessens the need for surgical intervention. There's a new product of the ACP that Arthrex has developed called ACP Max. So the idea here is we draw more blood. Regular ACP is only 15 cc's. This takes 60 cc's, and it's a double spin system with the centrifuge, as seen here. It takes a bit longer, but it allows us to get a higher platelet concentration. And there's some evidence to suggest that the higher platelet concentration may be better. We're studying that now, comparing it to the regular ACP, but this is kind of the future. For instance, if I treat somebody with regular ACP for knee arthritis, I usually recommend 3 injections a week apart. Now with the ACP Max, because it's more platelets, I've been doing just 1 injection instead of 3. And I'm seeing so far, anecdotally, the same positive effects. And we're studying this in a multi-center trial right now to prove that the ACP Max does as well as the regular ACP. So next, let's talk just a bit about stem cells. This is obviously a super hot topic. I don't want to get too much in the weeds scientifically here for you, but basically a stem cell is a cell that can reproduce and divide itself, but also it can form into other cell types like red blood cells, fat cells, neurons, muscle cells, cardiac cells, epithelial cells. True stem cells are more embryonic, which really is not what we do today. There's a lot of regulation with the FDA. So we do not give true stem cells. If you say you're getting a stem cell treatment, you're not getting a true stem cell. What we're really giving you is what we call mesenchymal or skeletal stem cells. These are specialized MSCs that only are going to transform into tissues of the skeleton, which would be bone, osteoblasts, or fat adipocytes, or chondrocytes, which is cartilage, and maybe neural cells possibly. So it's a different subset than a true stem cell. It's an MSC. So this is what you would get if you're going to get a stem cell treatment. So where do they come from? Most commonly, it's from the bone marrow. You can also get them from fat, and that's another option. But bone marrow is really most common. It's from the bone marrow itself, and you have to extract it. And so what we do is typically the iliac crest is where we go under local anesthesia with a special needle. We can extract bone marrow from the iliac crest, but it has to be prepared. So we have a special system we call the Angel system here that basically takes that bone marrow and concentrates the stem cells. There's not a lot of stem cells, mesenchymal stem cells, in the bone marrow. So you have to concentrate them to get the best effect for administration. So this Angel system that Arthrex has is what we use to do that. Where do we apply it? I use it in rotator cuff. Rotator cuff tear patients, many times we have problems with the cuff fully healing, especially if it's a revision repair. So on the left, you can see I put a couple patches where I soak the patches in the bone marrow stem cells, and then I close the rotator cuff over the top to help the healing. In the second picture there, it's used in the foot and ankle for helping to fuse joints. It has a great biologic product to help the bony healing. So in this particular diagram, you can see there's some staples placed across the joints, and then the bone marrow is applied at the same time. I've used it in the knee joint to help healing of grafts, where we can actually put the mixture of mesenchymal stem cells in the tunnels where we pour our graft in to help our grafts heal. And it's been used in spine as well to help with fusion and healing of spine problems. So in conclusion, for biologics, I think it's a very promising field for joint health and preservation. But we need much more science, and I would ask you to be aware of false claims and hype that's out there, regenerative medical centers that claim they can cure arthritis. No, you're not going to regrow cartilage. Really what we're looking at is pain relief for administration of either stem cells or PRP, but we need much more science to show what works the best, especially with some of the costs that are involved, that are out of pocket, not covered by insurance, and you don't want to spend a ton of money for a treatment that does not have a proven scientific benefit. So it's on us as clinicians and scientists to continue to do the research to show what actually works. But I can tell you right now, as of 2025, PRP is much more studied, especially for knee arthritis, as the best treatment in my opinion. It's also less expensive, and we have good data to show PRP does work to help for knee arthritis. So in conclusion, I would emphasize that all the nanotechnology that I've shown you today was developed locally here at Arthrex, where we are here today, in the administration building and the labs that are around here at Arthrex at the campus. And the nanosurgery that is so exciting for me in the future of arthroscopic surgery will be available at the new Hospital for Special Surgery at NCH down the street, which again opens May 1st. Thank you.
Before I let you go, Patrick, number one, Patrick gets the award for hitting the time cube better than any speaker ever. Yes, was to 0-0-0. It was
Perfect.
Beautifully done, just perfect. I mean, you can't. It's hard to do.
Practice.
All right, couple of questions. The nanoscope, is it useful mostly or exclusively in repairing and remediating soft tissue injuries? Do you use it at all with knee replacement or hip replacement or shoulder replacement?
Right, so the replacements are still done through an open incision because it's an implant. So basically what we're doing now is just for all the other procedures that we would do with the traditional scope, but less invasive in an awake situation. I think the future tower, though, is going to be in the office. Like you hurt your knee, you come in, you were playing pickleball, you twisted your knee. Instead of an MRI, I may just right there in the office put that scope in, say, hey, Tower, it's a meniscus, and I might be able to right there fix it even in the office. I think that's the future where we're going, to be so less invasive.
You just mentioned the magic word. How good has pickleball been for your business?
Yeah, well, it's been great. My daughter...
It's been great, he said.
My daughter is a physical therapist, calls it crippleball. So it's been good.
What's the most common injury you see from pickleball?
I think meniscus tears are probably number one in the knee joint.
Because it's a quick start and stop
exactly.
kind of motion.
Yeah.
I've been having a little pain in my left hip.
Okay. We got time.
And it was actually from playing pickleball.
Yeah.
And it's just weak. But it doesn't feel like it's, what have I got, Doc?
Yeah, you probably have a bursa problem, and a lot of times we can help that with the PRP injection.
Oh,
And
okay.
we
I'm
got
gonna go back and do that.
maybe we could do a little demonstration, draw your blood here. I've
Oh, you don't want to see.
the equipment's all behind me, so I'm available.
Yeah, you
so.
got the equipment right here. And my son, sliding into third base, did something to his shoulder. Probably popped out.
Dislocated his shoulder. yes,
Dislocated.
Yeah,
And probably did what? Damage to
yeah,
the
you tear what's
to
called the
rotator?
labrum,
The
the
labrum.
cartilage. That's what we can fix with the Nano 2 now. So
that would be a good
yes.
thing to do.
Yeah,
I'll send
absolutely.
him down
Yeah,
here.
well, we got to take care of him.
Patrick, thank you,
Thanks,
man.
Tara.
Thank
Okay.
you. Congratulations on the new hospital.